And so while I was studying at the university, I realized that all the people that were sick in my community were sick because of the radiation exposure. So I was a young woman. And back when I first started looking into this, when we didn't have the internet and research was really tough, you did it in a library, it was tough for me to find information that would support, what I believed to be true. But about 11 years ago now, we actively formed the Downwinders organization, and we've been working very actively ever since. And so, I was middle-aged at the time we really actively started the work on it, and it was just subsequent to having been diagnosed with thyroid cancer. I think the other part of the story to tell you is that my father died from cancer 3 years ago after having 3 different cancers. And that's another indicator of radiation exposure when somebody actually develops more than one cancer. And the man that helped co-found the organization with me, Fred Tyler, his mom died from cancer after having several different cancers. And it was then that we decided, we just can't. And when I talked to my doctor, who was an endocrinologist, she said, we have such a high rate of thyroid cancer in this state. And I talk to people about this all the time, physicians, and I ask them questions about it. And they all say the same thing. We have this incredibly high rate of thyroid cancer and other cancers. But thyroid, they know, is directly linked to radiation. And most of them will not go on record. A few weeks ago, I did a presentation to the city council and mayor in Socorro, and the mayor of Socorro is a physician. And the first thing he said was, please don't leave out the communities of Carrizozo and that area, because when I was a physician there was such a high rate of cancer. And the physicians in New Mexico know that that's true, and occasionally one will try to engage with us, but people are a little hesitant when it comes to that. And I don't, who knows why? Who knows if it's because they're here to practice medicine and they're not here to pass, a judgment or whatever. I don't know. But we're always looking for, a physician or a scientist or somebody who will support our effort, and they're out there. I've talked to many of them. I've talked to physicists, I've talked to physicians, and those health surveys that we're collecting, that'll be our case study. I want to say one other point on that, though. The people downwind of the Nevada site never had to rise to this level of proof. This is so ridiculous because they never had to rise to this level of proof. A group of lawmakers passed a law that extended compensation to them, and they were compensated. And we're having to rise to this level of proof. We were the first downwinders. We were the first people anywhere to experience a nuclear blast. And if you read the history, and I'll be glad to pass it on to Eileen, we have some first-hand stories that I share. These people have agreed to allow us to do that. And when you read some of these first-hand stories, it's remarkable. I mean, it was, imagine something so remarkable happening. People thought the world was ending. People thought the world was ending. And it was incredible. And to not have access to any information like we do now, this would not be a secret to us today, but it was a secret to people then. And people back then lived a very organic lifestyle, and that's why they were so horribly poisoned. In the little towns around Trinity, nobody had water systems. There wasn't running water yet. So everybody had cisterns, and you can imagine when the fallout got into the cisterns, it doesn't go away. I mean, that's going to be there forever, especially when you take a look at plutonium and the half-life of the plutonium isotopes. That's going to be there forever. And it got into the soil, and we grew everything we ate. That you didn't go to the grocery store and buy produce. You didn't go to the grocery store and buy meat in 1945. You bought sugar and flour and coffee. Those are the staples that they bought in a grocery store in 1945. So everything else had to be grown or harvested. The men hunted this area very heavily for rabbits, for quail, for deer, and all of that was consumed, and all of it was irradiated. And then, when you think about the access to water or the lack of access to water and the fact that they would either pull it out of the ditches, the acequias, or they would pull it out of their cisterns, it gives you an idea of what level of exposure they were